County, specifically coordinating universal health coverage, that is UHCL. Nyeri was selected to be a pilot county because of its perceived high burden of non-communicable diseases. This registration was actually, we were using a mobile application to do it called MTBA. And we actually noted that most of the community health workers did not own a smartphone that would actually have that application and were not very tech savvy to actually do that work. So in the initial stages, that is in the month of November and December, before the president launched it on 13th December in Kisumu, we mostly used agents who were maybe Form 4 leavers, college students, or university students, because it was during their holiday break in December. But the challenge we noted by using the students is that they did not know how the households were located. So most of them went for numbers. This was work that was actually had an allowance per day. So they were actually excited about the numbers, saying that I've registered 30 people today, 40 people. But we wanted the registration to be done in a household where you're not actually only registering an individual, but the whole household, that is the man, the wife of the house, and the children.
I must say that when we started the registration process, there was that problem. But what we've done at the hospital level, whatever within our health facilities, we have ensured that every person who comes along, we give them that message. We are even engaging our politicians. As I said, we have a strength in the community health volunteers. These are guys who are spread to the village level. So once we give them a message, they are able to go and tell the community that this is what it is.
So that is how we're able to capture the people who are not captured in the first phase of the registration. And using that strategy of using the community health workers, ultimately the registration status moved from maybe 64 to 84%. There are several lessons that we've learned. Maybe as the national government thinks about rolling this program to other counties, I think it needs to be well structured, or maybe start with the training of the community health workers, because we think that would be the best strategy to use, the community health workers, because the system is already there. They're already attached to households that they normally are mapped to, and they take care of the needs of this population. So maybe to train them beforehand, and if it's possible, the counties, since the county health workers are actually doing other work, the counties could actually provide them with the smartphones so that when the registration is actually happening, people do not come with their phones to do the registration, but actually we use smartphones that belong to the county or to the organization that is actually doing the registration.